The practice of radiology is undergoing a fundamental shift, driven by remote contrast supervision. What if your radiology group could reduce supervision costs by up to a staggering 70%? This is a powerful answer to the growing radiologist shortage crisis facing the nation. It also translates directly to better, faster, and more accessible care, especially in rural areas. Next, we will break down the regulatory, technological, and operational changes that make this possible. The main catalyst is a landmark decision by the Centers for Medicare and Medicaid Services. Historically, immediate availability meant a physician was physically present in the office suite. CMS has redefined it to allow remote supervision via two-way audiovisual tech. This permanent federal rule goes into effect on January 1st, 2026. The time for radiology groups to prepare their strategy is now. This change also has strong clinical backing. The American College of Radiology formally urged CMS to make this permanent and supports the model. The momentum is building nationwide as states like California, Ohio, and Tennessee are already enacting legislation to align with this new federal standard. So, with federal and state regulators on board, and with the ACR's support, what does this technology actually look like in practice? First, this is not starting from scratch. It is a logical extension of the teleradiology model that has been trusted for decades. The key is a compliant platform. It must support secure, real-time, two-way audio and visual communication for direct supervision. To be clear, consumer tools like FaceTime or standard Zoom are not compliant. Only healthcare versions with a business associate agreement are. But this raises a critical question. If the radiologist is remote, who is physically with the patient? And how can we guarantee safety? The regulations are clear. A qualified, licensed clinician, like an RN, PA, or NP, must always be physically present with the patient. This hybrid model can actually improve patient safety. One survey found 30% of centers using it reported faster response times to adverse events. So, safety is maintained by combining an expert remote radiologist with a trained on-site clinician for faster, more consistent responses. Let's examine where this has a massive impact. Critical access hospitals. These rural facilities often lack consistent radiologist coverage. This often meant transferring patients to distant facilities. The result? Delayed care, patient inconvenience, and lost hospital revenue. With remote supervision, these hospitals can now offer advanced imaging locally, retaining critical revenue and providing better community care. This model is a lifeline for small hospitals. But what does it mean for the operations of larger radiology groups and imaging centers? It opens up incredible staffing flexibility. Groups can provide continuous coverage across multiple sites, allocating radiologists time by demand. This flexibility allows imaging centers to extend operating hours to evenings and weekends, maximizing scanner use and revenue. It is a far more predictable and cost-effective solution than using expensive and hard-to-schedule locum tenens radiologists. The savings are more pronounced for certain studies. Remote supervision makes covering low-volume MRI contrast exams during off-peak hours viable. Let's not forget the human element. Offering remote work improves job satisfaction, helping groups retain top talent and combat burnout. So, connecting the dots, flexible staffing is more than an operational perk. It's a strategic tool against the national radiologist shortage. The right technology platform does more than connect people. By providing automated, audit-ready documentation, it reduces administrative burden. That permanent CMS rule is more than a policy memo. It is the key that provides access to care for rural and underserved communities. The evidence is clear. Regulations, technology, and finances all point in the same direction. What is the final takeaway for healthcare leaders? Remote contrast supervision is expanding for three reasons: supportive regulatory tailwinds from CMS and state governments, proven technological models that improve safety and efficiency, and undeniable benefits to finance, operations, and patient access. This is no longer a future concept. It is a permanent and growing part of modern radiology, offering a clear strategic advantage to early adopters. For radiology leaders, the question is no longer if you should adopt remote supervision, but how you will implement it to stay competitive.